بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about presenting some cases in pediatric age group with spot diagnosis. Here, this is the first case, child with 13 years old with back pain, and we have lateral dorsal spine X-ray and lateral skull X-ray. In the lateral dorsal spine X-ray, we see the vertebral body here, vertebral body, and that vertebral body is almost completely collapsed. We call it vertebra plana. And in the lateral skull X-ray, we see multiple irregular area of lytic lesion, this one here, and this one here, and this one here, and possible this one here. And these are associated with beveled appearance. And this is classic for eosinophilic granuloma. Here, this is our second case, 8 years old patient with abnormal gait, and we see here axial T2 MRI image with 2 cords, and this is, we call it diastomatomedia. Next case, look at it and try to pick up the abnormality. Here we see there is subependymal nodule on the right side, and we call it nodular heterotopia in this coronal T2 MRI weighted image. Look at this case and try to pick the abnormality. This is 6-month-old healthy boy with asymmetric face. As we see here, this is the coronal suture on the left side, and the coronal suture on the right side, it is almost syncytosis, giving the asymmetric appearance of the face. So this is unilateral coronal suture synostosis, and this is the sagittal suture. This is the 3D skull image. Next case, 4 years old child with diabetes insipidus. What could be the cause in this sagittal MRI T1 after contrast weighted image? We see enhancing mass in the region of the pituitary stalk, and the patient has diabetes insipidus, and this is highly suggestive of Langerhans histiocytosis. Next case, this patient has fracture, skull fracture on the occipital region, and this is a 3D image of the skull, and this is the axial T2 CT scan. We see bilateral subdural hematoma over chronic and acute one on the right side with mass effect. This possibly raise the possibility of non-accidental trauma, child abuse. Keep it in mind if you have fracture, skull fracture, uncommon site, and different ages of subdural hematoma. Here, this is another patient with developmental delay and seizures. It is 4 months old child. As we see here, there is a classic example of lissencephaly with possible agenesis of corpus callosum. And here we see thick, very thick cortex. Next case, this is 6-month-old child with bilateral, what we call it, coloboma. Here and there. The next case, 19-day-old child with a large head. As we see here, the posterior fossa is large with large cyst in it. And this is a classic example of Dandy-Walker malformation associated with hydrocephalus. The next case, this is 4-year-old child with sore throat. As we see here, lateral neck X-ray, we see a large adenoid with some airway compression, but very large palatine tonsil also with airway compression in the oropharynx. Next case, we have this child with 5 years old with trisomy 21 and weakness. And as we see here, there is atlantoaxial instability associated with os odontoinum. And also, incidentally, we have large adenoid and large palatine tonsils in this patient. This is the instability of atlantoaxial region with accessory os odontoidum. This is the next case, 8-month-old girl with leukorrhea. As we see here, there is bilateral masses in the both eye posteriorly, 2 on the right side and 1 on the left side in this T2 weighted images, and this is highly suggestive of retinoblastoma. Next case, this is sagittal T1 weighted images of the brain, and this is T1 FATSAT weighted images, and this 4-month-old child with abnormal neurological examination, and this is the classic example of the agenesis of corpus callosum associated with interhemispheric lipoma. That lipoma, it is hyperintense in T1 and it has become hypointense in T1 fat set. As we see here, the cingulate gyrus is absent. Here are some signs of the agenesis of corpus callosum in axial cut, and this is what we call it a racing car sign. It is a classic for agenesis of corpus callosum, and here in the coronal section we call it Morse head appearance sign in the absence of agenesis of corpus callosum. Thank you for listening, hoping to see you soon in another talk.